I'm Denise, your MC for tonight's webinar. I would also like to thank all of you for taking your time to join us this evening. Before we begin, our AB team muted all of you within the Zoom app to allow the session to run smoothly without interruptions. You can still continue to use the chat function within the app throughout the whole webinar. We will have a Q&A session towards the end. You can unmute to ask your question or simply type your question in the chat box. Presentation slides and pictures will be displayed during the sharing. If you can't see it clearly, you may zoom in for a clearer view. Welcome to today's insightful session on a topic that is more relevant now than ever, the silent killer, cancer. Thank you for being here for this session on cancer awareness. Did you know that cancer is the world's second leading cause of death? It often begins silently with abnormal cells growing uncontrollably in the body and can affect anyone at any age. Today, we are honored to have Sinjit, a passionate advocate for preventive science of nutritional immunology. She will share with us insights on how cancer develops, the early warning signs to watch for, and the current medical treatments available. Please join me in giving a warm welcome to Sinjit.
Thank you, MC. Good evening, everyone. First of all, I would like to thank EVG Network and my upline. My name is Sinjit. A big welcome to all of you for attending tonight's webinar. The topic for this webinar is the silent killer, cancer. With a heavy heart, let's get to understand what exactly is cancer. I've seen a lot of people panic and at loss of what to do when faced with cancer. Besides having to burden with costly medical expenses, the patient suffered the most, having to undergo the kind of pain during treatment and the constant worrying of any chances of recovery after treatment. Even family members will be equally worried. They may have to face the reality that their loved ones may not make it through. The entire process is truly tormenting. A lot of cancer patients pass away shortly after they have been diagnosed with cancer. This gives the impression that they are sentenced to death the moment they got cancer. But is this really the case? Can cancer be prevented? Cancer indeed scary, but if we don't understand about cancer, then it is even scarier. Tonight, let us get to really understand about cancer and prevent it from ever happening. According to World Health Organization, cancer is world's #2 killer. Cancer causes 1 in 8 deaths globally. Cancer takes away 10 million people's life yearly. That is 1 cancer death every 3 seconds. And predicted by year 2032, the number of cancer deaths will increase to 13 million annually. In fact, cancer cells are formed when normal cells' genetic materials or DNA are mutated. In the picture on the left, the red ones are normal cells. Normally, the cells divide and multiply in an orderly manner. Cells can live up to 90 to 180 days. But the difference is when normal cells ages and reaches at the end of its natural lifespan, it dies, also known as apoptosis. If cells is damaged, it dies earlier than expected. Picture on the right shows that when cell apoptosis is malfunction, normal cells mutate into cancer cells. Cancer cells continue to grow and divide forever. We call these cells immortal cells. So what exactly is cancer? Cancer is a condition in which these mutated cells multiply uncontrollably, grow in large numbers, and then destroy our normal body functions. In other words, they will invade and even occupy our organ until the organ is malfunction. A person will die when cancer causes organ failure. Now, can cancer be easily prevented? In fact, Dr. Zhao Fei Chen ever mentioned, cancer does not happen overnight. We have to commit the same mistakes 100 times for a cancer cells to form. In fact, cancer cell does not grow and divide as fast as we would have imagined. From 1 cancer cell split to 2, 2 cells become 4 cells, 4 cells become 8 cells, it takes few months for it to double. Some cancers even takes 6 to 8 months for it to double. Cancer does not happen overnight. When the amount of cancer cells reaches 1 millimeter, which is 1 mm, it's like making a period mark or full stop with a pencil. There are about 1 million cancer cells on that mark, and only the most sophisticated medical equipment is able to detect it. If a cancer tumor grows to 1 centimeter, which is 1 cm tumor, it's like the size of an eraser at the end of a pencil, and that already has about 1 billion cancer cells. Our body may not detect any tumor smaller than 1 cm, so usually those tumors that have been diagnosed are at least 2 to 3 cm size. And do you know some cancers are already in the terminal stage? When a malignant tumor grows to 10 cm, that person will be on the verge of death. Why is that so? Because there are only 60 to 80 trillion cells in our body. When the number of cancer cells is large enough to destroy an organ, it will cut off the blood supplies to other organs, and at the same time weaken the blood's ability to clot, which in turn causes some cancer patients dying of hemorrhage. And the toxic side effects from some cancer treatments can also suppress the functions of our immune system. In fact, 2/3 of the time cancer stays hidden. It cannot be detected. We won't know when a cancer cell is produced in our body. This is so-called incubation period. Let's take a look at the duration it takes for a different cancer to grow to 1 cm. Breast cancer takes 6 to 8 years. Colorectal cancer and lung cancer takes 10 to 20 years. For example, if a woman is diagnosed with breast cancer at the age of 40 years old, it means that she has gotten cancer at the age of 32 or 34 years old. If a person is diagnosed with breast cancer and this person always had regular checkups, but why wasn't it detected in the first place? In fact, this is what we call the incubation period, and cancer is not detectable by basic medical devices. We are unaware of the 2/3 of cancer periods, so preventing cancer is always the wisest choice. What are the difference between benign and malignant tumors? Benign tumors is cancerous, they multiply at a slower rate. Tumors that only grow in the same place usually do not metastasize to other parts or spread, such as cysts, warts, moles, polyps, etc. are all benign tumors. Generally speaking, these tumors can be removed by surgery without posing any health threat. If the tumor cells are completely removed, they will usually not recur. And the arrangement of these benign cells are relatively neat. But if it is a malignant tumor, it is cancerous. It grows rapidly and have obvious features. When under the microscope, the cells of malignant tumors are usually irregular and do not have a uniform structure. In this sense, it just represents the chaos brought to the body by malignant tumors. Even if it is surgically removed, malignant tumors can still metastasize or spread to other parts of the body, causing cancer to recur. Before being discovered, a tumor may contain millions of genetically identical and destructive cells. I'm sure now you are able to differentiate better. We often heard when someone are diagnosed with cancer, they will start to doubt, why is it me? What did I do to deserve this? They often feel that they are living healthily and pose no risk for cancer. In fact, cancer occurs silently, which makes it difficult for people to detect, which also increases the difficulty of diagnosis and treatment. Sometimes everything seems fine on the surface, but cancer may be lurking somewhere in the body. So, early detection is crucial to fight cancer. In fact, our body is very smart, but our internal organs cannot communicate directly with us. They can only alert us through some symptoms or pain that we can see or feel on the surface. This is also the precursor of cancer. Let's look at the first signs and symptoms of cancer, which is the appearance of lumps or thickening in some parts of the body. For example, when women go to obstetric and gynecology clinics, the doctor will teach them to touch and feel the lymph nodes around their breast. You can see in the picture, when a breast lump or thickening feels different from the surrounding tissue and there are enlarged lymph nodes under the arm, the doctor will recommend her to do further examination. Breast cancer patients mostly have lumps or thickening signs and symptoms. Some people will have discharge from the nipple. This is not the same as milk that have been produced after labor. Retraction of nipple. Change in skin of the breast, such as dimpling or puckering, redness, and swelling. Breast cancer takes place most commonly among women. So women have to constantly check their breasts and lymph nodes under their armpit for any abnormalities. But of course, breast cancer not only occurs in women, but men as well. It's just that the chances in men are lower. But if men get breast cancer, their condition will be way more serious. Lump or thickening is also a sign of testicular cancer, which is the cancer of the male reproductive organ. If a man has an abnormal lump in his testicle, he may develop testicular cancer. Next up, let's take a look at skin cancer. What kind of skin changes are related to skin cancer? Let's look at the signs and symptoms of skin cancer. A change in a wart or mole, such as size, shape, color, and texture, unexplained bleeding, dry scaly patches, or pimples that never seems to go away, constant itchy skin and rashes. Usually only warts or moles are seen on the body at the beginning. Have you encountered some people having a lot of warts? Their appearance is somewhat similar to corns, but corns are not a sign of cancer. Warts may develop into cancer because it is caused by a virus. Some people may have 1 or 2 warts initially. We usually observe whether its shape, color, and structure have changed. It will have some changes if it is cancerous, such as it's getting bigger, more spreading out, changes in the shape, and from light brown to dark color. Such changes may also be precursor to skin cancer. The structural change is not only on the shape, it will also pop up or dent and become 3D-like. If it is not a single transformation, but a variety of changes in size, shape, and structure, you won't feel any pain when touching it. Therefore, many people will just ignore it. Some people may treat it like having corn. Therefore, people with warts or moles should pay attention to whether these warts have the above changes. Another cancer that has skin changes as its signs and symptoms is non-Hodgkin's lymphoma. For this cancer, patients first started with itchy skin, rashes. They would get these signs and symptoms treated as general skin diseases. They would take steroid and antipruritic drugs when it itches. They would never have thought that these were signs of cancer. Therefore, they didn't consult a professional doctor. In fact, some itchy skin or rashes will eventually become non-Hodgkin's lymphoma, as shown in the picture. Let's look at the next slide, mouth and throat problems. Did you see a lot of ulcer inside the mouth? Do you find it quite common? We may think that this could be due to being heaty, late night sleep, or having deep fried food. Sometimes we have mouth ulcers for a few days when we accidentally bite our tongue while eating. And if it is recovered after a few days, then that is not a sign of oral cancer. But if it is oral cancer, such as mouth, tongue, throat cancers, then the signs and symptoms would be persistent sore throat, difficulty in swallowing, which lead to difficulty in eating. These could also be signs of throat cancer that will affect a person's appetite. Mouth and tongue ulcers all year round. Oral bleeding. Oral bleeding would not be treated as the same as the external bleeding. For external bleeding, we will bandage it as soon as possible. For oral bleeding, it will flow backwards, such as oral bleeding during sleep. Will we wake up because of it? Usually, we only realize it when brushing our teeth. Some people have foul breath all year round, and some serious loose teeth, meaning their teeth will just fall off without any cavities. Loose teeth alone may be periodontal disease, but when it is coupled with other symptoms, it is more likely a precursor to oral cancer. Some people have oral discomfort, which causes changes in speech pattern. These changes may be the signs of oral cancer. Let's look at what are the signs and symptoms of lung cancer. Some people have chronic coughs, coughing out blood, wheezing, which may be signs of lung cancer. Enlarged lymph nodes in the neck, but sometimes you do not feel it when lymph nodes start to swell. Some lung cancer patients even have signs of chest pain. The kind of cough we mention here is not the kind of cough that will recover after a few days. Even if it is whooping cough, also known as pertussis cough, it will stop after some time. This kind of premonitory cough of lung cancer is chronic. You can actually see the person coughing all year round. For this, you have to be mindful because it is very difficult to treat lung cancer. In fact, a lot of non-smokers come down with lung cancer. It may be due to inhaling secondhand smoke. Some people will get lung cancer even though they do not smoke, or people around them also do not smoke. Next up, let's look at the possible signs and symptoms of ovarian, cervical, uterine cancer. Abnormal vaginal bleeding is one of the main symptoms. The kind of bleeding is different from menstruation. Another symptom is pelvic or lower back pain. In fact, our body always gives us a lot of symptoms. So it is important for women to get themselves checked regularly. Why is it people often have the impression that their days are numbered whenever they are diagnosed with cancer? It is because the cancer tumor had already grown to 10 cm by the time it is diagnosed, and it is already too late by then. So do consult a doctor early when you discover these signs and symptoms. With early detection, the successful rate from treatment will be relatively high. Next up, let's take a look at if there is changes in bowel or bladder habits. Those could be signs and symptoms of kidney, bladder, or prostate cancer. First is blood or pus in urine. So, do we bleed when we pass urine? No, right? Let's sidetrack a little. You may think that protein is discharged if you get urine bubbles when you pee. Sometimes pregnant women discharge protein through their urine when they pee. All these are abnormalities, and it is best to get it checked. But nowadays, a lot of people rarely notice it, even if there's blood or pus in their urine. It's because they immediately flush once they have done their business. Some just walk away without looking at it. Some don't even turn on their toilet lights, even at night. You have to pay attention if there's burning pain during urination. It could be caused by kidney stones, or it could be kidney cancer, bladder cancer, or even prostate cancer. If it is back pain or pelvic pain, it's also related to these cancers. So do not underestimate it if there's any changes in bowel or bladder habits. Next up, changes in bowel or bladder habits are also signs and symptoms of colorectal cancer. Food goes through esophagus to get to the stomach for digestion and then absorbed by the small intestine. And those that our body doesn't need will be excreted through the large intestine. The large intestine is very long and requires a lot of fiber to help excreting smoothly every day. If unwanted food is not excreted in 24 hours, stool will form and a lot of toxin will be produced, and it is closely related to colorectal cancer. Consume too much of red meat poses higher risk of getting colorectal cancer. The risk is 2.2 times higher than the average people. Currently, there are about 1,000 new cases every year. This is due to red meat being harder to digest, and it will become stool in the large intestine when there is not enough fiber. So what are the signs of colorectal cancer? Bloody stools, abdominal cramps, frequent constipation, or unusual frequent diarrhea, and some will experience loss of appetite. Cancer does not happen overnight. Those who have constipation for a long time need to pay more attention. Cancer cells will divide and multiply from 1 become 2, 2 become 4, so on and so forth. Next, let's look at what are the signs and symptoms of gastrointestinal cancer. Indigestion and nausea. Some people may think they have poor digestion and it's normal, but sorry to say, having poor digestion also means that it is difficult for their body to absorb nutrients from the food. When a person's down with cancer, not only it is related to what they eat, but it's also related to what they don't eat. If a person has poor digestion, do you think this person will have enough nutrients in the long run? It's definitely not enough. Diarrhea, bloating, loss of appetite, and burping may be signs and symptoms of gastrointestinal cancer. Please don't take it lightly if you have one or more of these signs and symptoms at the same time. You may think these signs and symptoms are very common. A lot of people have it, but all these signs and symptoms are unhealthy signs from the perspective of preventive science. Am I right to say that I believe nobody will say that they are 100% healthy? This is because sometimes we stay up late, stressed, picky at food, and only eat food that we like and not choosing the food that our cells need. What are the other common signs and symptoms of cancers? Chronic fatigue. The chronic fatigue here refers to unusual fatigue. For example, even with 8 to 10 hours sleep daily, a person still feels tired. Some couldn't sleep while lying on bed, but fall asleep while sitting down. Do you think a healthy person will get tired for no reason? So, what kind of person gets tired very easily? That is people who are sick. The second common sign is sudden and excessive weight loss. Have you heard of someone's weight is suddenly dropped from 7 kg to 50 kg? That's a weight loss of 20 kg in a very short period of time. This is sudden and excessive weight loss. Unless that person has plans to slim down, otherwise a sudden drop of 5 kg could depict that he has some health problems. Why is that so? Because nowadays it is so hard to lose just 1 kg, let alone 5 kg. Why is sudden and excessive weight loss a precursor of cancer? The cancer cells need nutrients during their growth, but where does they take the nutrients from? They are greedy and guzzle up nutrients reserved for normal cells. Normal cells need nutrients to function properly, but cancer cells will take the nutrients away because they divide and multiply rapidly. For example, my bones need nutrients, but cancer cells steal the nutrients from my bones and release toxins, making the organ malfunction. Some cancers also affect the digestion system, interfering with the body's absorption of nutrients. Cancer can invade blood vessels in the body. Through damaging blood vessels, cancer can lead to internal hemorrhage or bleeding in critical areas of the body. Speaking of hemorrhage, it reminds me of the signs and symptoms of oral cancer and colorectal cancer that I mentioned earlier. Why do cancer patients feel tired easily? This is because they are anemic. Next common signs and symptoms of cancer is swollen lymph nodes. Lymphatic system is the immune system's second line of defense. So if lymph nodes are swollen, it is more likely to be cancer. Of course, it does not mean that lymphatic swelling is lymphoma, not necessary. When the above common signs and symptoms coupled with frequent infections of flu-like symptoms, doctors may suggest checking for leukemia. Signs of non-Hodgkin's lymphoma and pancreatic cancer is enlarged liver or spleen. What does all the above mentioned signs and symptoms tell us? Cancer does not develop without any warning. So if your body shows any of the abnormal signs and symptoms I mentioned above, it is advisable to get checked. When a person is diagnosed with cancer, he usually follows their doctor's advice and begin treatment as soon as possible. There are three common cancer treatments: cancer surgery, radiation therapy, chemotherapy. For some cancers, patients may need to take medication after surgery. For example, for those hormone-related cancer, such as breast cancer, patients may require to take hormone therapy drugs after surgery. Let's take a look at cancer surgery. Surgically remove of only parts of a tumor or an entire localized tumor. For example, if a woman is diagnosed with ovarian cancer, the doctor may suggest removal of ovaries. And if the woman is already old, the doctor will usually recommend for removal of uterus as to prevent spreading. Have you heard before? For breast cancer, some patients will have the affected breast partially removed and some have the entire breast removed. If some cancers have already spread to the limb, doctors will recommend to remove the lymph nodes as well. So, what should a man do if he has cancer in his reproductive system? Now, every surgery has its treatment risk or complications. Surgery may stimulate the cancer to spread. Complications during surgery also include uncontrolled bleeding and damage to internal organs as a result of tumor removal. Surgery comes with side effects such as pneumonia and more prone to infections, internal or external bleeding. Men may suffer from impotency, lost control of bladder or bowel function. Surgery may have limitation to treat certain types of cancer. In order to ensure the elimination of residual malignant cancers after surgery, doctors will use radiation therapy, chemotherapy, or other types of treatment. Radiation therapy, also known as radiotherapy, uses high-energy radiation or radiation beam generated through X-ray machines or radioactive isotopes to either completely destroy a tumor or damage cancer cells' genetic materials, making it impossible for the cells to keep growing and dividing. Radiotherapy is usually administered externally and precisely at where cancer cells are present. Radiation therapy comes with many side effects. Firstly, it affects glands and bones. For example, when the gland that secretes the saliva has been destroyed, this causes difficulty in swallowing food. A person with this problem takes a mouthful of food followed by a mouthful of water whenever they eat. Other side effects of radiation therapy is people's skin become darker or even appear as if it is burned after radiotherapy treatment. In addition, there will be hair loss if radiation therapy is applied directly to the head, nausea, difficulty in swallowing, oral ulcers, and fatigue. Chemotherapy. It uses cytotoxic drugs to kill fast-growing cells like cancer cells. Ladies and gentlemen, can you imagine what it will do to you when this poison enters our body? It will kill cancer cells as well as our healthy cells, fast-growing cells at the same time, causing immense damage to our health. What sort of side effects does patient have after chemotherapy treatment? The side effects are hair loss, fatigue, nausea, vomiting, rashes, depression, throat inflammation, nose bleeding, weight loss, anemia, and look pale. Why vomiting, hair loss, or nausea? The cells of our oral cavity, scalp, and gastrointestinal tract are also cells that divide and multiply rapidly. Just like our hair, it will grow back after 2 to 3 days. When undergoing chemotherapy, the cells of our scalp, stomach, oral cavity will be killed and causing malfunction at the organs. Medical treatments is constantly improving. Previously, chemotherapy may cause hair loss, but now some patients does not have such side effect. Therefore, Dr. Zhao Fei Chen referred to cancer treatment as a form of gambling. What does that mean? It means gambling on whether the treatment kills cancer cells first or killing our healthy cells first. So no matter what kind of cancer, doctor always remind patients that they need to maintain their weight, Cancer patients have to pay close attention to their weight if their weight keep dropping during the course of treatment. Now, we have talked about various cancers, the signs and symptoms, and the treatment methods. Let's understand about SEER Cancer Data Review. From 1975 to 2013, the National Cancer Institute's statistic on the 5-year survival rate for various cancer treatments. So what is the 5-year survival rate of cancer treatment? This is the percentage of cancer patients who are still alive 5 years after their diagnosis or treatment. In other words, it is a general indicator of treatment effectiveness. Let's take a look at which cancer had the lowest survival rate within 5 years. And the first one is pancreatic cancer with 8%. It has a relatively high mortality rate among cancer. Lung cancer survival rate within 5 years is only 18%. Esophagus cancer at 19%. Stomach cancer at 29%. Brain cancer at 30%. Ovarian cancer at 46%. So what are the cancers that have more than 50% 5-year survival rate? Colon cancer at 65%. Cervical cancer, kidney cancer, bladder cancer. Which cancers have more than 80% 5-year survival rate? Uterine cancer at 85%. Hodgkin's lymphoma, breast cancer, malignant melanoma, testicular cancer, and prostate cancer. Previously, only 76%, now 98%. This means that medical science is advancing, but we still cannot rely entirely on medical treatment because the 5-year survival rate does not mean recovery. It does not represent recovery because it does not mean that there will be no recurrence at the 6 or 7 years. Therefore, as the saying goes, you have to fight it for life once you have cancer. In fact, everyone has cancer cells and we have to fight with it every day. Now we have understood that cancer does not happen overnight. We can discover it early by observing whether there are any abnormal changes or signs and symptoms in our body. We should consult professional doctor for physical examination if there is any abnormalities. So when a person is diagnosed with cancer, they will usually seek treatment. Basically, cancer treatments are surgery, radiation therapy, and chemotherapy. At present, we already know that all surgery has risks and the cancer treatments may lead to complications and will have side effects. And also, the successful treatment rate is not high for some difficult to treat cancers. These cancer treatments may be able to improve the survival rate of cancer patients, but have you ever wondered what kind of price they have to pay? Sometimes treatment only help to prolong a patient's life for a few months or maybe few years, but does it really improve the quality of life of the patients? In fact, prevention, early detection, and early treatment are still the best way to fight cancer. Preventive measures include regular health checkups and proper health education can help to prevent cancer and other deadly diseases. More and more evidence shows that nutritional immunology, which is a preventive science, will become a key role in the fight against cancer. Through sufficient rest, regular exercise, positive mindset, balanced diet, and maintaining a healthy immune system is the most reliable and safest way to fight cancer without any side effect. In fact, why do we need to understand about cancer? Because we want to prevent the world's number 2 killer, which is cancer. We can also prevent most of the diseases as long as we can prevent cancer. With this, my sharing ends here. I wish all of you good health and longevity. Thank you.
Thank you, Sinjek, for the wonderful sharing. Now that we understand that cancer is not a sickness that happens overnight, it is preventable, and it all starts from inculcating the right lifestyle habits from today. it is important that we start looking at healthy habits such as sufficient sleep, regular exercise, mental positivity, and a nutrient-rich diet that is nutritional immunology food for an overall well-being and a stronger immune system. Has anyone benefited from consuming nutritional immunology food? Yes, of course. In our next segment, we will hear from Darren to share how one ovarian cancer survivor achieved amazing recovery and her healing journey through the power of nutritional immunology. Before we invite Darren for the sharing, I would like to seek everyone's cooperation by not taking any photos during the testimonial sharing. With this, please welcome Darren.
Hi everyone, I want to share a story about a friend, Belinda, today. So her journey seriously opened my eyes and I hope it does the same for you. So Belinda has always been a super health conscious person because her own mom passed away from cancer. So Belinda was all about healthy eating and getting her regular checkups. And she thought that she was doing everything just right. But then back in 2019, things starts to feel off. She was gaining weight, especially around her stomach, and then no matter what she tried, right? Like different diets, nutritionists, nothing seems to work. Then came the headaches, the period pain, and then the moment when her doctor found a big hard lump in her tummy. Then Belinda suddenly remember, she hadn't had a checkup done over 1.5 years. The diagnosis hit her like a ton of bricks. Ovarian cancer, stage 1C, almost stage 2. Now, can you even imagine her fear, her disbelief? How conscious person? So she was absolutely terrified, especially the thought that it might have spread. But in that scary moment, a new path opened up for her. Science of nutritional immunology. So it was a huge eye-opener. She realized it wasn't just about food. It's also stress and emotion, which she had a lot from her demanding work and job, and that likely played a massive role. So before surgery, Belinda jumped right into consuming high quantity of nutritional immunology food containing rich and varieties of polysaccharides such as cordyceps mycelium, ABM mushroom, and various types of mushroom. Also high quantity of antioxidants and phytochemical nutrients from wholesome fruits such as cactus fruit, Accelera cherry, and many more. And honestly, it was like watching a miracle happen. So her surgical wounds healed so fast with hardly any pain or swelling. Then came chemo, and that was brutal. The exhaustion, her hair falling out, constant nausea, and losing her sense of taste. It was just crushing experience. But what truly blew her away was how quickly her energy bounced back and within a week. And from this photo, you can see how fast she recovered her hair loss. 1st of April. Okay. And from the 1st of April, you can see her scalp. And in the same month, on 29th April, pretty obvious, right? She recovered almost 90% of her hair. So after that, she added more nutritional immunology foods such as soy, cereal husk, raisin tree fruits, hawthorn, and many more. And this became, her daily must-haves. So it has been 4 years since her last chemo sessions, and Belinda is still maintaining her must-have diets, her spirit, her energy, how she looks. So the feedback from all her friends, she looks even better now than before she got sick. So beside all this whole experience taught her a priceless lesson. Her hospital treatment and surgery cost about 100,000 Sing dollars. And that's mind-boggling amount. It made her realize deep down that prevention isn't just a good idea. It is absolutely essential. It's about investing a little bit now on health to save a fortune later. And not just about money, but in pain and suffering. So her recovery is a living testament to the science of nutritional immunology. So congrats to Belinda. And with this, I end my sharing.
Congratulations, Belinda, for regaining her health through the science of nutritional immunology. So, Darren, where can I find the ingredients you mentioned earlier that Belinda has consumed?
Thanks, MC. The mentioned wholesome ingredient Belinda has been consuming is from Elite Global. So let me share. So before and after the surgery, she was consuming complete nourishment series. So 300 ml of Rhapsody and Rosy Thyme, and 3 sachets of Immunity. And during her chemotherapy, due to the loss of appetite, she added 1 sachet of soy green for each of her daily meals. So that means including breakfast, lunch, and dinner. So that means 3 sachets, right? So in addition to that, 2 sachets of raisin tree and 1 sachet of berry bits daily. Again, congrats to Belinda, and hope my sharing of Belinda's story today can be an inspiration to everyone. And let's cherish our health, embrace prevention, and live healthiest lives together. Thank you.
Thank you, Darren. Based on the earlier presentation by Sinche, we also learned that ovarian cancer has a 46% of non-recurrence. So it is still important, even after recovery, to continue taking care of our immune system to prevent reoccurrence or a relapse. I'm glad that Belinda is continuing the must-have diet, a prevention journey through nutritional immunology. Next, I would like to bring your attention to a disclaimer. Elite products are plant-based food, which are very beneficial for health maintenance. However, Elite does not advocate any form of self-diagnosis or medical treatment. If you have any medical condition, please seek professional medical help. Now, we have come to the Q&A session. I believe that through the sharing just now, you may have a question to ask. You can unmute to ask a question or type in your question in the chat. We will try our best to answer all your questions. Please limit to 1 question per person. Okay, let me look at the chat box right now. Okay, I saw a question from Cindy. Can we eat mushrooms or take antioxidants during cancer treatment? Is there anyone from our Q&A team who can assist with this excellent question?
Hi, MC. Maybe I can help to answer this question. So good evening, everyone. I'm Daniel here. This is definitely a good question. So can cancer patients consume mushrooms or antioxidants during the treatments? I have a few slides. Maybe I can share with you all. Please give me a moment. So I hope everyone can see my slides. So we often hear that doctors will tell the cancer patients, do not consume any mushrooms or antioxidants during the cancer treatments because it may interfere with the treatments. Actually, the doctors is referring to radiotherapy. Just now, our speaker has shared with us earlier on regarding the cancer, what are the types of cancer treatments. Maybe we can do a recap here. So how chemotherapy works? So chemotherapy works by using the cytotoxic drugs and to kill the cancer cell, and usually administer through intravenously, which means that it's through our vein. So how radiotherapy works is actually to generate high energy radiations or free radicals to cause the oxidative stress to kill the cancer cell. So the role of antioxidants is to neutralize the free radicals to protecting the cells from the oxidative damage. So now the concern is taking high dose of antioxidants might protect the cancer cells and possibly reducing the radiotherapy effectiveness. And the fact is, this statement is actually based on a theoretical speculation and is not clinical research. And theory doesn't equivalent to clinical evidence. So it's just a reasonable hypothesis and not backed by a large-scale clinical trials. So these original ideas actually came from a Nobel Prize winner's article, which warned against antioxidant supplements. So which means that they're actually referring to antioxidant supplements like vitamin pills during the radiotherapy, and not referring to natural wholesome foods like fruits and vegetables. Hence, mushroom and high antioxidant wholesome food are actually safe during the cancer treatments. So what is the dietary guidance during the cancer treatments? So cancer patients should avoid high dose of antioxidant supplements, example vitamin C, vitamin E, and even beta-carotene. The reason is because high dose of vitamin C can actually increase the risk of cancer. And cancer patients should avoid processed meat, like red meats, and high fat and high sugar diets. And they should also avoid extreme dieting or even imbalanced nutrition. And what to include? Fruits and vegetables that rich in phytochemicals like cactus, mushroom, they are rich in polysaccharides like shiitake, maitake, ABM mushroom, and cordyceps mycelium. Stress, stable emotions, enough sleep and rest, and appropriate exercise, coupled with a balanced nutrition in order to have a healthy body. And last but not least, food can actually support healing, but supplements should be used with caution. So I hope I've answered your questions. My sharing's end here. Thank you.
Thank you, Daniel, for demystifying the conception of not consuming mushrooms or antioxidants during cancer treatment. In fact, antioxidants can neutralize free radicals and protect our cells from oxidative damage. We also learned that mushrooms and colorful fruits and vegetables that are high in antioxidants can help fight cancer. The more plant-based nutrition, the better it is during chemo or after. Let me see whether there are other questions. Okay, there are no more questions. We shall end the Q&A session here.